Singapore nursing interview questions. Why do you want to be a nurse? Example answer: I have always been passionate about caring for others and making a positive impact on their lives. Nursing provides me with the opportunity to combine my empathy and strong medical knowledge to provide holistic care to patients. I am driven by the idea of contributing to the well-being of individuals and their families during their most vulnerable times. Can you share an example of a difficult patient interaction you've had and how you handled it? Example answer: during my clinical rotation, I encountered a patient who was resistant to their treatment plan and frequently expressed frustration. I took the time to actively listen to their concerns, empathize with their emotions, and involve them in decision-making about their care. Through open communication and building trust, we were able to find common ground and work together towards their recovery. How do you prioritize and manage your tasks in a busy healthcare environment? Example answer: in a fast-paced healthcare setting, I use a systematic approach to prioritize tasks. I always start with the most critical and time-sensitive tasks while considering the patient's condition. I also delegate appropriately and communicate effectively with the healthcare team to ensure seamless coordination of care. How do you ensure patient safety and prevent medical errors? Example answer: patient safety is a top priority for me. I follow established protocols and double-check medication administration and procedures. I also maintain clear and accurate documentation to ensure continuity of care. If I encounter any uncertainties, I don't hesitate to ask for clarification from a senior nurse or physician. How do you handle a situation where you disagree with a physician's treatment plan? Example answer: I believe in open and respectful communication within the healthcare team. If I were to disagree with a treatment plan, I would gather relevant information and research to support my concerns. I would then approach the physician with my observations and suggestions, focusing on the best interests of the patient while maintaining a collaborative approach. Can you describe a time when you had to provide emotional support to a patient or their family? Example answer: I had a patient who had just received a difficult diagnosis. I spent time with them and their family, actively listening to their fears and concerns. I provided information, reassurance, and a compassionate presence, helping them navigate through their emotions and make informed decisions about their care. How do you handle stressful situations or emergencies? Example answer: in emergencies, I rely on my training and stay focused on the task at hand. I remain calm and quickly assess the situation, following established protocols. Clear communication with the team is crucial, and I prioritize tasks based on the urgency of the situation. Afterward, I ensure proper documentation and participate in any necessary debriefing. How do you handle a situation where a patient is uncooperative or resistant to care? Example answer: when encountering an uncooperative patient, I approach the situation with empathy and patience. I try to understand their concerns and address any fears they may have. I involve them in their care plan, explaining the rationale behind each step. By building rapport and establishing trust, I find that patients are often more receptive to the care they need. Can you share an experience where you had to work as part of a multidisciplinary team? Example answer: during a complex case, I collaborated with doctors, therapists, and social workers to develop a comprehensive care plan. We held regular meetings to discuss the patient's progress, adjusting interventions as needed. This collaboration resulted in improved patient outcomes and a more holistic approach to their care. How do you stay up to date with the latest advancements in nursing practice? Example answer: I am committed to lifelong learning and staying current with evidence-based practices. I regularly attend workshops, conferences, and webinars. I also engage in online nursing communities where professionals share insights and experiences. This dedication ensures that I provide the highest quality care to my patients. How do you handle a situation where you make a mistake in patient care? Example answer: in the event of an error, patient safety remains my utmost concern. I would immediately inform my supervisor and follow established protocols to rectify the situation. I believe in being honest and transparent, both with the patient and the healthcare team. I am committed to learning from mistakes and taking steps to prevent them in the future. Can you discuss your experience with handling infectious diseases or maintaining infection control? Example answer: during the COVID-19 pandemic, I played a pivotal role in implementing strict infection control measures. This included proper use of personal protective equipment, adherence to hand hygiene protocols, and educating patients and their families about infection prevention. I take infection control seriously to protect both patients and healthcare providers. How do you manage your own well-being and prevent burnout in a demanding nursing role? Example answer: self-care is essential to maintaining the high standard of care I provide to my patients. I prioritize a healthy work-life balance, engage in stress-relieving activities outside of work, and seek support from colleagues and mentors when needed. By taking care of myself, I can continue to give my best to my patients. What do you believe sets you apart from other candidates for this nursing position? Example answer: my combination of clinical expertise, strong communication skills, and genuine empathy make me a well-rounded candidate. I have a proven track record of effectively collaborating with healthcare teams and creating a positive patient experience. I'm excited about the opportunity to contribute my skills and dedication to your esteemed institution. How do you handle a situation where a patient or family member is dissatisfied with the care they received? Example answer: I approach dissatisfaction with empathy and a willingness to address concerns. I would listen actively to their feedback, acknowledging their feelings. Then, I would explain the steps I will take to resolve the issue, involving appropriate team members if necessary. Clear communication and a commitment to resolving their concerns are key. Can you discuss a time when you had to provide end-of-life care or support to a patient and their family? Example answer: I had the privilege of caring for a patient nearing the end of life. I ensured their comfort, managed their symptoms, and provided emotional support to both the patient and their family. I helped facilitate important conversations about their wishes and ensured their dignity was preserved throughout the process. How do you handle situations where ethical dilemmas arise in patient care? Example answer: ethical dilemmas require careful consideration. I consult relevant policies, guidelines, and involve the healthcare team in discussions. In one instance, when faced with a difficult decision regarding treatment withdrawal, I engaged in open dialogue with the patient's family and healthcare professionals to arrive at a decision that aligned with the patient's values. How do you ensure proper communication with non-English speaking patients or those with language barriers? Example answer: communication is essential regardless of language barriers. I utilize translation services, interpreters, and visual aids to effectively convey information. Additionally, I use nonverbal cues, gestures, and active listening to ensure the patient's needs are understood and met. Can you share an experience where you had to respond to a rapidly deteriorating patient's condition? Example answer: during a night shift, I noticed a patient's sudden deterioration. I immediately initiated appropriate interventions, called for assistance, and communicated with the physician. My quick response and clear communication contributed to stabilizing the patient's condition and facilitating a timely transfer to the intensive care unit. How do you manage time and ensure patient-centered care in a busy nursing environment? Example answer: time management is crucial to providing quality care. I prioritize tasks, delegate when appropriate, and use technology to streamline documentation. However, I also emphasize the importance of spending meaningful time with patients, listening to their concerns, and addressing their needs to ensure a holistic and patient-centered approach. What motivated you to specialize in specific nursing specialty? Example: pediatric nursing, critical care. Example answer: I've always been drawn to specific nursing specialty due to the unique challenges and rewards it offers. For instance, in pediatric nursing, I'm passionate about contributing to the well-being of young patients and their families during pivotal moments in their lives. This specialization allows me to combine my clinical skills with my nurturing nature. For more, subscribe our channel.